Hello, my friend, and welcome back to my channel. If we haven't met yet, my name is Eve. I'm a nurse, a birth doula, and a Catholic mama who is super passionate about helping other women prepare for birth experiences that they will love. Today we are going to chat about some pros and cons of getting an epidural and some things that you should know before you make that decision. Currently, we know that somewhere between 70 and 80% of the population choose to get epidural anesthesia at some point during the labor process. And that's a really significant part of the population considering how many babies are born each year. And while there's nothing wrong with that, it's definitely an intervention that a lot of women choose without giving pause or second thought, just kind of assuming I'm gonna get the epidural. That's how I've always imagined that I would do it. That's how I'm going to do it. There are definitely some pros to getting an epidural, which we will talk about, but there are also plenty of cons that many women aren't aware of before they decide to get one. And I've definitely heard women be told that epidurals don't have really any side effects, which just isn't the truth. Something I would often see with my labor patients is that they would just go ahead and get the epidural without really asking any questions, and then there would be a host of other things that came along with that procedure that they weren't aware of. But at that point, they'd already gone through the procedure, received the medication, and there wasn't much that we could do to change the situation that they were in at that point. So I firmly believe that the best thing you can do for yourself is be educated on this procedure going into your labor and your birth so that regardless of the decision you make, whether epidural or no epidural, you're doing that from a place of confidence. And just remember that each of these pros and cons is going to be weighted differently depending on your own unique situation. What is the best decision for one mama might not be the best decision for another. So let's go ahead and start by diving into the pros. The first and most obvious pro of getting an epidural in labor is going to be the pain relief aspect, right? When most women think of getting an epidural, this is what they're thinking of. So when you get an epidural put in place, they will put a needle into your back and then thread a tiny little catheter through that, which will deliver medication into your back. The goal of that medication is going to be to essentially numb you from the waist down so that you're no longer feeling the sensation of your contractions. And because you're no longer feeling the sensation from your contractions, you're hopefully no longer feeling pain, and that can be a huge upside. That's why most women choose to get an epidural in the first place. The next pro is giving mama some rest. So a time where I often see epidurals actually be really helpful and effective is during super long and strenuous labors. Say that mama has been laboring for days at this point and she can barely keep her eyes open and she's feeling delirious between contractions. Well, that's not really a super positive experience for anybody, and oftentimes mama will drift off into sleep because she's so exhausted, but then be woken up every couple of minutes by the sensation of her contractions. Oftentimes, women in that position will choose to get an epidural just simply so that they can get some rest and some sleep and recuperate themselves. And a lot of the times, this honestly makes women feel brand new, and this can be a really positive tool in those situations where mama really just needs to get some rest. The third pro of getting an epidural is relaxation. Sometimes women will just be so tight and tense during labor, and they are not effectively able to let their body relax during those contractions, which is super important for labor progress. When you're tightening up against contractions, it not only makes labor more painful and challenging to manage, but it can halt labor progress altogether. So you're not only having then these painful, challenging contractions, but they're not really going anywhere because your body is just way too tense and tight to relax. I've definitely seen it happen before where a mama's just way too tense, and getting the epidural allows her to relax and allows her contractions to actually go somewhere. The next pro is going to be that epidurals don't affect your mental awareness the same way that a lot of other pain relief options in labor do. Like if we're going to look at the difference between an epidural and medications that you would get through your IV in labor, those things are usually going to affect your mental state and make you kind of loopy or groggy or out of it, whereas an epidural doesn't normally do that, at least not to the same extent. So that's a definite pro, that you can get pain relief while not having it affect your mental awareness or your being present during your labor experience. And then the last pro that I am going to cover is having an epidural in the case of emergency management. So I will give a caveat. I feel like sometimes this can be used to really back women into a corner and make them feel like they are forced into getting an epidural. And I don't want that for you. I find that to be one of the most frustrating things ever when women are essentially told it's either an epidural or a C-section, your choice, because most women aren't going to be like, yeah, sure, give me surgery before they choose to get an epidural. But oftentimes moms in that situation didn't want the epidural to begin with. However, I will say, in the event that it looks like things are really heading down that path of a necessary cesarean section, it can sometimes be less traumatic for women if they already have an epidural in place, because that means that they don't have to receive general anesthesia if a C-section does become necessary. So they're still able to at least be awake and somewhat alert for the surgery if they do end up needing surgery, versus being put completely under if they end up needing a truly emergent C-section. But again, with the caveat that truly emergent C-sections don't happen nearly as often as they can sometimes be made out to be. Even if your baby's showing some signs of distress, there is usually going to be time for you to get a spinal put in place and to be numbed. So this doesn't happen as often as a lot of times it can be framed. So now that we've gone over some of the pros of an epidural, we are going to talk about the cons list. Just a little disclaimer about the cons. So I will say that I think the cons list does tend to kind of outweigh the pros list, as far, like, at least from an objective standpoint, right? There tends to be more cons than there are pros, but that again doesn't mean that it's going to be overall worse for your situation to choose to get an epidural. Also, sorry, you're hearing my baby squawk a little bit in the background.
Hey, Bubba's.
Okay, so the first con is going to go along with the pain relief aspect. Because you are numb, you have a loss of mobility most of the time. Now, this varies because the actual dose of medication that you will get through your epidural varies, and sometimes they can do a little bit of a lighter dose so you can still maintain some bit of mobility for women who want some relief but still want to be able to feel what's going on. But that doesn't mean that you're going to be up and walking about the room. Usually you still need a little bit of help repositioning yourself. You're not going to be like up on your feet on the birth ball, right? Usually you're at least going to be in bed. Now, there's still all sorts of position changes you can do in bed to help progress your labor and make sure that things keep moving, but that's a huge con for a lot of women. And one thing that can just lead to a higher likelihood of a C-section is that loss of mobility. And with that numb feeling, a lot of women just really hate the way that feels. It's kind of like if you've ever fallen asleep on your arm and then you wake up and it's all floppy, you can't move it, and you have to like pick it up yourself. That's kind of a similar feeling when you get an epidural. A lot of women that makes them feel trapped in their body and they hate it. The next con is going to be that you have to actually have something called a Foley catheter inserted. When you are numb from the waist down, you actually lose the nerve impulses and the ability to empty your own bladder. And it's really important that your bladder stays empty during labor for a whole variety of reasons. With that being said, if you get an epidural, they will have to insert a Foley catheter, which is a tube that goes up through your urethra into your bladder, and then they'll inflate this little balloon that makes it stay in place, and that drains your bladder for you. And that can lead to an increased risk of developing a UTI. A lot of women also just find it really uncomfortable and overall just kind of invasive in general. The next con of getting an epidural is that it can really subject you to something called the Cascade of interventions. And I would love to do a more in-depth video on this at some point, but that essentially is the idea that one intervention tends to lead to another intervention and ultimately can send you down the trajectory of having an unnecessary cesarean section that you might not have had otherwise. I'm gonna go hand off my baby real quick. The way that I often see this play out in a woman's labor is she will be laboring along and then she will go ahead and get the epidural, and that will slow down her labor. I've heard various reasons for why this happens. I think a lot of it has to do with the brain's signal to produce oxytocin, honestly, but I've also heard some nurses theorize it's because women are getting hydrated from the fluids they're receiving. I don't think that I agree with that quite as much, just in my own experience, but it does tend to slow down labor. I've seen that happen over and over again. And then when that happens, usually a provider will suggest that we get Pitocin on board to go ahead and augment the labor. Say baby doesn't respond well to the Pitocin, or mom's blood pressure drops and now baby has signs of distress. And so all of these things can kind of lead down having more and more medical interventions. And we have kind of turned what was a low risk situation into now a high risk situation because of the side effects of the epidural. So women who get an epidural are more likely to need an assisted delivery, like using a vacuum or forceps to deliver baby, and are more likely to end up with a cesarean section. They're also more likely to have those other interventions I talked about, like Pitocin. And another thing is if you have an epidural, you will need to have continuous monitoring. So you know, those two like bands that are strapped across mom's belly, a lot of women will have those anyway in labor, but you are no longer a candidate once you have an epidural for less invasive forms of monitoring, like intermittent monitoring with a Doppler, for example. The next con or risk associated with getting an epidural in labor is that it can really cause your blood pressure to drop. This happens all of the time. Part of the procedure of getting an epidural is you'll receive fluids through your IV first before you get the anesthesia on board, because the anesthesia has the known risk of dropping your blood pressure rapidly, and they want to avoid that. So they will usually fluid load women, and you'll get what's called a bolus, so like a whole bag of fluids before you actually get the epidural, but it doesn't always work effectively to prevent that blood pressure drop. When mama's blood pressure drops, not only can it be really unpleasant for her and cause dizziness, nausea, feelings like you're kind of blacking out or browning out almost if it's severe enough, but it also decreases the amount of oxygen getting to your baby, because when your blood pressure drops, then that also means that baby is getting less blood volume. And going back to that cascade of interventions thing, sometimes that causes the necessity for more medical interventions to help baby out. The next con is that the medication from an epidural does pass through the placenta to the baby. So an epidural doesn't usually affect baby the same way that other pain relief options in labor would, such as IV narcotics like we talked about earlier in this video. But a small amount of that medication does still pass through the placenta to the baby. And there are some studies suggesting that babies who are born after a mother receives epidural anesthesia are generally sleepier and could have a harder time with breastfeeding after birth. There are also some studies to suggest that the epidural interferes with oxytocin release, which is necessary for that letdown reflex, and that moms who receive epidurals in labor actually have lower breast milk supply in the immediate postpartum period and then also 1 month later. But again, that's just one study, so it's a little bit inconclusive of whether or not that's universally the case, but there's some evidence to suggest that the epidural passing through the placenta can affect baby and can therefore also affect breastfeeding. The next con to getting an epidural are that there can be some unpleasant side effects. Not everybody experiences these, but a lot of women do, and they wonder why, and they weren't aware ever or informed ever that those are pretty normal things to experience after receiving an epidural. So some of those side effects could include intense itching, for which they usually give you more medication, intense shivering, which can also be normal when you don't have an epidural in place, but it can certainly kind of amp up the effects of that. And then also uneven pain relief. So sometimes an epidural will only take to one side of the body, which is sort of the worst of both worlds, right? Like you are numb totally on one side, so you don't have the mobility to be able to cope, but then you're feeling everything on the other side. Or you might have these little hot spots where the medication's taken to most of your body, but there could be, for example, a spot in your abdomen where you're still feeling everything, and that can just be really wacky. Okay, I have 3 quick more cons to go through. So the next is going to be that when you have an epidural, you're usually going to have a longer recovery because that medication is still in your system and it will take a while for you to no longer be numb and therefore to get up and go to the bathroom, and just a recovery in general, right? It tends to be longer for women who have an epidural. They have to wait to get that catheter taken out. Next is that with an epidural, you're more likely to tear because women tend to spend a longer time in the pushing stage when they have an epidural, and usually the not being able to feel or the numbness necessitates something called a coached pushing, which is where you're on your back and your team is kind of counting and coaching you to be able to push because you can't feel the sensations. So with an epidural, you're more likely to tear or have an episiotomy performed. And then the last con is that because of those increased fluids that you get, we talked about earlier, as they're setting up for the epidural, they are going to give mom a bolus or a bag of fluid to prevent the blood pressure from dropping. Because of that, mom can experience some uncomfortable swelling after birth. And not only mama, but baby usually takes on some of that fluid as well. And they have to do something called diuresing, which essentially means they just have to pee it off. But that can then look like they have actually lost more weight than they truly have. It can give the appearance that baby is losing weight rapidly when really it's just that they're peeing off fluid from mom getting an epidural. Alrighty, y'all, so that is the complete list of pros and cons that I could think of throughout my nursing experience and what I've seen of receiving an epidural or not during labor. Just like every other birth interventions, epidurals are tools that can be really useful in the right situation, and that decision is going to look different for every woman. But again, regardless of what you choose, it's important that you make that choice from an informed and empowered place so that you don't regret your decision in the long term and look back at your experience with regret. If you want more information to help you prepare for an empowered, God-centered natural birth, you can go ahead and click the link in the description of this video, and that will take you to my free mini birth class that you can sign up for. Y'all, thank you so much for being here and watching this video. If you are expecting a baby soon, please know of my prayers for you and know how grateful I am that you stayed to the end of this video, and I hope to see you back next week.